So yes, we've been very concerned because the suicide rates among Black youth aged 10 to 24 have more than doubled over the past decade, and increased more than across other racial ethnic groups. And suicide is the third leading cause of death for Black youths. Also, in the past 25 years, suicide attempt rate for Black youth has increased by 75%. So this is causing a lot of alarm, and which is one of the reasons why we decided to do a national study looking at some of the risk and protective factors associated with suicide in Black youth and young adults. So we found that if you had a mental health diagnosis of depression or psychosis or schizophrenia, prior deliberate self-harm was a big risk factor, was one of the strongest risk factors. If you had also another very strong risk factor was if you had a history of concussions or traumatic brain injury, exposure to violence, family conflicts. If you were living in an urban area or a community with high social level vulnerability, which would be in an area with significant poverty, low education, high unemployment, inadequate transportation, or crowded housing. We also found some protective factors. We found that youths living in communities with higher density of religious organizations were associated with a 30% lower risk of suicide. And this was actually a big finding. And religious organizations may be a proxy for a stronger community cohesion, increased opportunities to engage in faith-based or community activities that promote resilience. So I think doctors, physicians need to screen. Screening is critical for suicide. Um, we what we're really focused on is upstream approaches like screening to identify youth at risk and intervene early to prevent suicide attempts from even happening in the first place. So early intervention is critical for those children that do, youth and young adults that do attempt suicide. It's imperative that they receive timely and effective evidence-based treatments for suicide prevention. And these evidence-based treatments can be in the schools, it could be in primary care settings, or in outpatient specialty care.